Okay, I'm just getting this back to where we left off, which was with the accessory structures. So we've gone through all of the parts of the dermis, the epidermis. We've even talked about the subcutaneous layer, which is deep to the dermis. Now we're going to get into some of the other structures associated with the integumentary system. We'll begin with hair. Um, Hair itself is not just something dead that grows out of your scalp or your skin. It's actually threads of fused epidermal cells. So the same cells that make up your stratum corneum are tightly packed together to form the hair structure. The base of the hair is actually surrounded by a living tissue. It's called the follicle. It has nerve endings and blood vessels and an oil gland associated with it. The whole function of hair is to guard and protect the skin, protect openings around our body as well, which is why hair grows in particular places like around our eyes or around our mouths, in our ears, within our nose, to kind of capture any dust or debris before it enters our body. There's also nails and glands that are associated with the skin. Did I go too far? No, I didn't. Sorry, I thought I skipped ahead accidentally. Nails are slightly different than hair. They're plates of packed keratin epidermal cells. So again, the same types of cells that are making up your hair are making up your nails. They're just packed in a different way. They have the visible nail body. That's what you see when you look down at your nails. There's the free edge, which is the part that you can see if you look at the underside of your hands or the palms of your hands. Some of us that have long fingernails can see the free edge. The nail matrix is down near the bottom of our nail. That's in this general area. That's where the cells are growing from. It's the proximal end of the nail. The whole purpose of a nail is to help grasp and manipulate structures, as well as to protect the ends of our fingers and toes. So let's get into some details now. Hair is present on most surfaces of our skin other than the surface of our fingers, our palm, the soles of our feet, and that's again for increased friction in those areas. Adults have large distributions of hair all over the scalp, eyebrows, around the external genitalia. The hair around the external genitalia is associated with specialized sweat glands to help with antibiotic properties as well as to help attract the opposite sex, although most of us try to disguise those scents by using perfumes and such. The thickness and distribution of the hair is determined by genetics as well as hormones. That's why guys have different patterns of hair distribution than girls do, and that's why, for instance, if your father has a unibrow, you might also have a unibrow because that is a genetic determinant. The main function of hair is for protection, helping to protect our scalp from injury as well as from ultraviolet radiation. It's also there to protect our eyes from foreign particles and our respiratory system from incoming foreign particles as well. The anatomy of the hair, the superficial portion that you see projecting through the skin is called the hair shaft. The root is the portion of the hair that's below the skin surface, and that sometimes goes all the way through the dermis into the subcutaneous layer. The hair follicle itself is the living portion. This is the area that surrounds the root. It's composed of living epidermal cells. It consists of a bulb, which is at the very base of the follicle. This is where blood vessels come in to help nourish the growing hair. There's also a hair matrix, which is where new hairs are produced through mitosis, allowing for hair to grow and lengthen over time. There's a root hair plexus, which is a special nerve ending that goes around every follicle. This is going to be stimulated when the hairs are moved or disturbed in any way. This is why even if your eyes are closed, you can feel if somebody walked next to you, or you can feel a breeze because those little hairs on your arms are moving, activating the root hair plexus. There's also small smooth muscles associated with every single hair follicle. They're called erector pili muscles. They're located in the upper dermis. They contract under stress as well as fear, and cold sensations are going to cause them to contract. That's why when you get a little afraid, sometimes you get goosebumps. Of course, when you're cold, you're going to get goosebumps, and it's because those little erector pili muscles associated with every single hair follicle contracts, allowing that hair to stand up. The sebaceous glands are other accessories associated with our hair follicles. They, of course, secrete their secretions into the hair shaft or into the hair follicle, lubricating the hair to keep it moist. Here you can see some of the anatomical structures I was mentioning. The blood vessels all coming here into the root of the hair, which is deep to the skin surface. This entire structure is the hair bulb. When you pull your hair out, sometimes you'll get a little bit of the bulb on the end, and that's what you see as that thickened end part of the hair. If you did a cross section of the hair, you can see that it has several different layers, different types of cells. The hair follicle itself is going to be the outermost area, and then the hair root is where you would have the pigmented layer of our hair, as well as some other supporting structures of the hair. If you take a look at the hair as it sits within the follicle, you can see how it goes down through the epidermis and then deep to the dermis. Some of them, again, even go into this subcutaneous layer. You can see the blood vessels associated with the hair follicle nourishing those cells. That root hair plexus right here, that's those special nerve endings. The sebaceous gland here secreting its sebum or oil into the hair follicle. And finally, the erector pili muscle, which can contract and allow that hair to stand up. Hair color is actually determined by melanin, the same type of protein that determines your skin color. Melanin, of course, is made by those melanocytes within the matrix of the hair bulb, and that's going to pass into the cells of the root and the shaft. Dark hair contains mostly brown and black melanin. Blonde and red hair have variants of yellow and red melanin. People that have red hair have more iron. People that have yellow hair, or blonde hair rather, have more sulfur in their hair. Gray hair is actually will occur sporadically, as some of you may have sporadic gray hairs at this time, and that's because the melanocytes are beginning to die off, so they're not producing the pigment as they used to. White hair is the absence of melanin completely within the hair. Androgens are special sex hormones that will affect hair. Androgens are a masculinizing hormone. It is both in males as well as females. This is going to determine the pattern of hair growth on your body. Some women have facial hair. Most men have facial hair. That's all determined by the types of androgens and the amount of androgens that you have. Hirsutism is the condition of excessive body hair. This can result from a tumor on the adrenal glands or tumors on the testes and ovaries as well, leading to overproduction of androgens, which will then lead to excessive body hair. Androgenic alopecia is the technical term for male pattern baldness. This is when the androgens are inhibiting hair growth, when there's not enough androgens, or the androgens aren't binding to the correct receptors that would normally stimulate hair growth. Males tend to lose hair at their temples and at their crowns, so that kind of growing forehead that some men get, that's called androgenic alopecia, and it's because of misfiring of those androgens, which would normally increase hair growth. Women can have thinning on the top of their head as well. It's usually towards the back of the head, as opposed to that typical male pattern baldness, which is with that growing forehead. Rogaine or minoxidil can cause the vasodilation within the blood vessels to enlarge the follicles and to lengthen that growth cycle. So for about a third of the people that actually use Rogaine, that is going to work. The other 2/3 are just wasting their money. Let's talk about some of the other accessory structures. We've talked about hair in detail. Let's talk about the different glands. Hair follicles all have a sebaceous gland associated with them. We've mentioned those. Sudoriferous glands, those are the technical term for sweat glands. You can almost see the term odor in there, so think of stinky sweat, sudoriferous, or sudoriferous, thinking of that odor word. And then ceruminous glands, those are the earwax glands within our ears. So let's talk about sebaceous glands to get us started. These are special oil glands. They secrete sebum. Sebum is the anatomical name for oil. Oil is made of mostly lipids and cellular debris, so some of the waste products from metabolism are sent out of the body through oil. The purpose of oil is to soften skin as well as to prevent the desiccation or drying out of our hair. It also helps to prevent water loss from our body surface. Our cells on our body surface within the stratum corneum are dead, so they're not as tightly locked together as the cells of, say, the stratum basal. So some water can actually escape or evaporate off of the surface of our skin. That's actually the way we lose the majority of the water from our body. So that oil on the surface of our skin helps to form a kind of like a watertight barrier to help prevent water loss. There can also be blackheads and pimples that develop. Blackheads are from enlarged sebaceous glands that have basically accumulated too much sebum, and those occur on very oily parts of our body like our nose and forehead. Pimples and boils are formed from bacteria that are digesting and breaking down that sebum. So again, they're going to occur in those oilier parts of our body, but it's not from enlarged sebaceous glands. These are rather from the bacteria that are living inside of the sebaceous glands, eating away all of that extra oil that's there. Kind of makes your skin curl to think about all of that bacteria living there. Some of it helps us, but some of it, as you can see, it is not always beneficial. Sudoriferous glands come in a couple different varieties. There are eccrine glands. These are the ones that secrete the watery secretion that you have, when you have sweaty palms or when your forehead starts to sweat because you've been exercising. Those are all because of the eccrine glands. Apocrine glands are special sweat glands that produce a thicker, more milky colored sweat. This type of sweat is very thick with electrolytes and metabolic waste products, and this is only in the axillary or armpit areas as well as pubic regions. So that's why the hair in those areas is different than the rest of our body. It's because they're associated with apocrine glands as opposed to the normal eccrine glands that are over the rest of our body. This is also why you put deodorant or antiperspirant in your armpits as opposed to on your arms and legs, right? The apocrine glands that are within your armpits produce that stinkier sweat that we don't like to smell. Ceruminous glands are the earwax glands. They're within the ear canal, the outer ear as well. They secrete cerumen, which is the technical name for earwax. They contain lipids like all of our sebaceous glands do. There's also other cellular debris. Basically, any of our body secretions, tears as well as sweat and oil, are all separate ways for our body to remove of wastes. Cerumen, as you know, is a very sticky substance. It forms a nice barrier that's going to help trap any debris or pathogens or even insects from entering the ear canal. You wouldn't want any bugs climbing in there and laying eggs, so the earwax is there to help prevent that. Here's a picture of some of these special glands that we mentioned. The sebaceous oil glands are all associated with those hair follicles, as I mentioned. The eccrine sweat glands, these are around most of our body. They're different than the apocrine sweat glands, which are associated with those hair follicles, making the hair in the axillary and pubic regions slightly different. Nails are the final accessory structure. These are plates as opposed to bundles of tightly packed keratinized cells. Nails are going to help with grasping as well as manipulating small objects, protection, and it also allows for the scratching or manipulation of body parts. The overall anatomy of our nails: they appear pink because of the underlying blood vessels. They have a free edge, which is white because it goes beyond the skin, so that's why the tip of your nail is a different color than the body of your nail. The lunula is that little white half-moon circle that you see at the base of your nail. It's a little thicker, and blood vessels are not visible there, which is why it appears white. There's also a root to your nail, just like there was a root to your hair, and a matrix to your nail, just like there was a matrix with your hair. The matrix is where the cells grow. The cells become keratinized. As that nail grows outward, the cells within this matrix are kind of pushed out, just like the cells within your hair. Here you can see some of the structures I was talking about. The free edge is extending beyond the nail. It's white because it doesn't have the underlying vascularization that you would have within the nail body. The lunula is very, very thick, so you can't see those blood vessels. There's the cuticle holding the edge of the nail in place. There's also a root of the nail going deep into the dermis layer, and the nail matrix is where the nail will grow from. So cells within this proliferating layer of the nail matrix are going to push these other dead cells out and beyond the free edge. So let's talk about the skin's role in body temperature regulation. When it's too hot, the surface of the skin is going to help radiate that inner body heat to the outside. So our body can actually sense that it is a hot temperature outside, and there's special eccrine glands that are going to produce the sweat to help get rid of body heat through evaporation. This is why you sweat when it's hot. It's your body's way of trying to cool off in a hot environment. The blood vessels are also going to play a role. So it's not just sweat glands that are going to be activated. Your blood vessels are going to vasodilate. In other words, they're going to get bigger. And what that means is, as those blood vessels get bigger, it's going to allow more of that warm blood in, and that warm blood is going to dissipate or radiate heat to the skin surface. So sweat production is increased, and the heat is being radiated out of the blood vessels because those blood vessels are nice and big, allowing excess heat to radiate out of the body. When it's too cold, the blood vessels are going to constrict. They're going to get more narrow to help conserve body heat. They're also going to get narrower at our distal parts of our body. So within our fingers and our toes, those are usually the first places that get cold when it's cold outside, as opposed to areas of your abdomen and thoracic cavity. Your abdomen and thoracic cavity blood vessels will try to stay as thick as they can and as open as they can to help keep those vital organs functioning appropriately. Sweat production is reduced when it's cold outside as well. Erector pili muscles are going to contract, and what that does is it allows for a nice thermal layer of air in between the tops of those hairs and the top surface of your stratum corneum to kind of trap some heat close to the body's surface and form almost a blanket of air around your body. Let's talk about the skin's role in protection. First and foremost, it's our barrier from the external environment. Keratin, that protein that's filling up all of our cells of our skin as well as our hair and nails, is going to help to protect from heat, abrasion, chemicals, as well as certain pathogens. There are special Langerhans cells that are within our integumentary system as well to help phagocytize invading pathogens. They basically eat them up like little Pac-Men. The skin is self-renewing and self-repairing. So if it's broken, the new cells will undergo mitosis and grow to fill the space. This animation goes through non-specific disease resistance. We'll get into other types of disease resistance when we get into the immune system later on this semester. Let's look more closely at how a wound would heal. First of all, those basal cells are going to sense that there is some type of gap or hole. They're going to help to migrate and spread out to fill that hole. You can see here kind of like falling dominoes. They fall into that hole. They slide in. They secrete something called an epidermal growth factor, and the epidermal growth factor will basically say, hey guys, we got to start doing mitosis. And so that basal layer will begin to not only fall into the hole and fill the space, but these cells will also undergo mitosis to help replace the lost cells. And as the cells within that layer undergo mitosis, that's of course going to feed into stratum granulosum and spinosum and eventually build all the way back up to the stratum corneum. Deep wound healing. A wound is deep once it goes past that stratum basal layer. In other words, once you get bleeding on the surface and your dermis has been hit by whatever has just punctured you, it's going to go through a slightly different healing process. First thing that happens is, sorry about that. First thing that happens is a blood clot's going to form. A deep wound going into the dermis is going to break into capillaries. This is when you get bleeding on the surface. So a platelet plug and a clot will form at the surface to basically block off any invaders from getting in. the blood vessels are going to dilate. That might not make sense at first. You would think, well, if there's a wound, why would you want the blood vessels to dilate and let more blood to the area? Well, it has to do with the function of blood. Blood is there to help bring in nutrients and take away waste products. So that new blood that's coming in, because these vessels are nice and dilated, is going to sweep away all of the debris and dead cells and maybe even pathogens that have come in. And it's going to bring with it nice oxygen and nice fresh nutrients to help those cells regrow and replenish the area. Immune cells are going to come in with that blood as well and help to digest any pathogens that may have come in, as well as any foreign material. Eventually that clot is going to turn into a scab at the surface, and that's getting down to some of the final steps. I skipped some steps accidentally. There's special fibroblasts here that are going to secrete fibrin. That fibrin is what ultimately forms the scar that you see, that is the scar tissue. After those fibroblasts secrete all of their fibrin, kind of reforming the matrix of the dermis, then our epithelial cells begin to migrate back together and form that scab, as I mentioned. And the collagen fibers that were laid down at this point, where we should be looking at this diagram, those collagen fibers that were laid down are so much thicker at this layer that it's going to leave a scar. Depending on the amount of collagen fibers that are laid down, that's going to determine the degree of scarring. So if the cut is not that deep, there's not that much fibrin laid down, and not that much collagen fibers laid down, then you won't have that much of a scar. But if the cut's very deep and your cells have to work very hard to repair the area, more than likely you're going to have some significant scarring. Let's talk about special sense receptors in the skin. We've hinted at these along some points. For instance, we've talked about the root hair plexus before, but let's talk about some of our other receptors. First of all, you have nociceptors. Nociceptors are special types of receptors that sense pain. This can be a sharp, itching type of a pain, or a kind of dull, achy pain. For the most part, the nociceptors that are associated with your skin are going to sense that prickling or sharp pain, like you touch a sharp object. That's going to be the type of pain sensation within these types of nociceptors. There's also Merkel's discs or tactile discs. These are within the epidermis, and they're there to have to sense light touch. Meissner's corpuscles are a deeper version of those tactile discs, and they sense touch as well. The Ruffini's corpuscles, they sense a stretching of the skin. So if your skin is being pulled or stretched, the Ruffini corpuscles are going to notice that. The root hair plexus I mentioned before, that's if the hairs move. Imagine a breeze blowing this hair to and from. That's going to stimulate the root hair plexus down here. And finally, the Pacinian corpuscle is going to sense deep pressure or deep touch. Something that's digging into your side, for example, would probably, probably stimulate a Pacinian corpuscle. The skin can actually absorb and excrete substances through its surface. We talked about how most secretions, such as sweat and oil, are also going to secrete cellular debris and waste products. And so transdermal patches use this point of entry to deliver things like birth control as a type of estrogen, or nicotine to help aid in cessation of smoking. Toxic products can also come into the skin, which is why you have to be careful when you're using particular cleaning products or nail polish removers, other types of toxins getting on the skin. You may notice some labels on some products will say, avoid contact with eyes or avoid contact with skin. That's because it's not just going to hurt your skin, but it can come into the body through your skin. Your skin, of course, excretes water. It also secretes a little bit of carbon dioxide, salts, ammonia, urea comes out through the sweat as well. Urea is the main protein in your urine. They're all metabolic waste products. So we tend to usually think of things like our respiratory system, urinary and digestive systems as the main systems that get rid of waste, but our integumentary system helps get rid of wastes as well. The skin also plays a role in calcium homeostasis. You're going to be seeing this thread of calcium in the majority of the body units we cover. Calcium is super important to a number of body systems. It's not just about your bones. Skin is actually going to produce vitamin D after about 5 to 30 minutes of UV exposure or sunlight exposure. Those who have lighter skin can go out for less amounts of time. Those that have darker skin are going to have to spend a little bit longer outside to get the same type of vitamin D synthesis. Vitamin D is then converted into a more active form between the livers and the kidney, and vitamin D is going to aid in the absorption of calcium from the digestive tract. So you need that vitamin D in order to absorb the calcium. This is why a lot of the times your milk that you will drink is actually fortified with vitamin D. That way you're automatically getting the calcium and the vitamin D in one shot. Otherwise, you can get it from other dietary things such as leafy green vegetables, or just spend some time outside. Let's talk about burns. Burns, of course, causes damage to your integumentary system, and depending on how deep it is, it's going to cause varying degrees of damage. Of course, the deeper it is, the more damage you will incur, and for the most part, damage is irreversible with burns. Various things can cause burns. We typically just think of heat, but electricity can cause burns. Corrosive materials, chemicals, can cause burns, as well as radiation. So burns are classified by their degree of damage. A first-degree burn would be mild pain, some redness, no blistering. Your skin functions as normal, and it would heal within 3 to 6 days as that stratum corneum is regenerated. An example of this would be a sunburn. A second-degree burn would have pain, redness, as well as blisters. A blister is where the epidermis is actually going to separate from the dermis, and fluid in the form of white blood cells and cells that are helping to repair the tissue, that's going to form within that layer. Edema or swelling can take place as well. Your hair follicles and glands are not injured in this, so hair will regrow eventually. Usually, if there's no infection, this is going to heal within 3 to 4 weeks. There's no grafting involved in this case. A third-degree burn is when the burn goes all the way through the epidermis and dermis and down into the subcutaneous layer. So look at all the structures that are being burned in a third-degree burn. In a third-degree burn, you're burning all of your epidermis, all of this dermis layer, including the papillary and reticular layers, as well as into your subcutaneous, your adipose tissue. Look at all your nerve endings, look at all the blood vessels, all of the sensory receptors, all of that is being burned as well in a third-degree burn. This is severe pain. However, the pain stops after the burn has taken place. So while you're burning, it is very painful, but afterwards it may not be as painful depending on the degree of burn, because your nerve endings have been damaged, so they're not sensing the pain anymore. Lots of swelling. Your skin can turn black or white because of the degree of charring that takes place. Lots of tissue damage. This is highly susceptible to an infection because so many blood vessels and nerves have been damaged. It's a very slow healing process. This may require skin graft, in other words, taking skin from one part of the body and transplanting it to the burned area in order to minimize scarring and promote healing. That, of course, is the most dangerous type of burn. The consequence of burns, ultimately, your skin receives lots and lots of blood flow with any damage, so there's lots of fluid loss. There could be shock related to the burn as well, lots of loss of water, loss of proteins. That's going to result in a drop in blood pressure. Reduced blood pressure is going to lead to reduced circulation. Because you have less fluid in your body, you're not going to produce the urine to get rid of all the toxins as efficiently. So one of the things doctors or clinicians will do when you're suffering from a burn is also get you started with some IV fluid, some saline fluid. That way your body fluids can stay up and your blood circulation can continue as it needs to sweep away all of the debris and pathogens that may have entered. Bacterial infections are very, very common with burns because there's no protective skin covering. The immune system cells are unable to reach the site because of differences in blood flow and blood pressure. So burns can be very devastating. This is an example of skin grafting. With the luck of stem cells and the technology of stem cells, scientists are actually able to create these kind of like screens, and they can grow human skin on these screens, separate the skin from the screen, and then what you have is basically a big piece of skin that you can transplant onto a human. Let's just review briefly some age-related changes in the skin. Typically, hair loss, if it's going to occur, is going to start at around age 30. Some obviously will begin earlier, some will begin later, and that's all determined upon genetics. The average is around age 30. Most of your skin changes are going to begin around age 40. Some of your environmental factors that influence skin you'll see earlier in life, such as excess tanning, smoking. You're going to see those effects much earlier than age 40. Age-related changes in your skin include the collagen fibers beginning to stiffen and break apart. The elastic fibers are going to start to clump together, losing their elasticity. The fibroblasts are going to decrease in number, which means you're going to have less ability to create the collagen and elastic fibers, and a slower healing process because those fibers aren't going to form as quickly. The skin's going to form wrinkles because of the breakdown of those collagen and elastic fibers. Beyond age 40, you're going to see a decrease in immune response because of those Langerhans cells, and those phagocytes become less effective. The oil glands are going to decrease in size, so the skin's going to become drier as you age. Sweat production is going to decrease as well, which means you're going to have a harder time regulating your temperature. The melanocytes decrease, and that can cause age spots. It can also cause the gray hair because some of the melanocytes, instead of decreasing in number, are going to swell and get bigger. The subcutaneous fat is lost, which is why skin appears saggier at older ages, and hence the wrinkling as well. Mention skin cancers briefly. Of course, we all are aware of the idea that sunlight causes skin cancer. Excessive UV, both UVA and UVB can lead to skin cancer. So all of those advertisements for tanning beds saying, but it's UVB rays, it can still cause skin cancer. The types of skin cancer you should be familiar with are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Basal cell carcinoma is the majority of all skin cancers. These are very slow-growing tumors, have a very low metastasis rate. This is, I don't want to say the good cancer, but if there were any cancers that were not as harmful as others, this would be it. It's not as aggressive as some of the other cancers. It arises from that stratum basal, so you can imagine those epidermal layers. This is just coming from that those very bottom cell layers within the epidermis. So it's a fairly superficial type of cancer. When you get the squamous cell carcinoma, this is 20% or so of all skin cancers. This is coming from the squamous cells, so this could be at any layer of our skin except the basal layer. This is from persisting lesions, from sun damage. This can metastasize. It metastasizes much quicker than the basal cell will. Malignant melanoma is the most aggressive, but it's also the least common form. This is coming from the melanocytes. Melanocytes are rooted in that basal layer, but they also project into the dermis, which is what allows them, when they become cancerous, to metastasize more rapidly. This can also lead to fatality within months of diagnosis. Some people might not realize they have a melanoma, think it's just, an irregular mole or a scar from something, and little do they know that it has metastasized to other areas of the body, which is why it's the most dangerous type of skin cancer. Most people will ignore it until it has already metastasized, and then it can be too late at that point. You should follow the ABCDE rule. A stands for asymmetry, B stands for border, C is for color, D is diameter, and E is evolving. So these are the things you look for when trying to diagnose a malignant melanoma. You can see what a normal mole looks like, and you probably have one or two on your body somewhere, maybe even more than that. They're nice and symmetrical, they have a nice clear border, the color is uniform, they have a set diameter that doesn't change, and they don't change in size. Whereas a malignant melanoma, you can see all of these various colorations, the border is kind of wishy-washy, it's very irregular, there's no regular diameter, it's very large, and you would assume that this may even be changing in shape within days or even weeks possibly. So light skin gives you a higher risk of malignant melanoma. Amount of sun exposure, specifically the number of severe sunburns you had before the age of 18. That's a significant indicator for this, as well as a family history of cancer, your age, your immune status. If you have a autoimmune disorder such as rheumatoid arthritis or lupus, or a family history of autoimmune disease, this is going to suppress your immune system, which is going to possibly allow for these cancers to grow more commonly. And that ends Chapter 4.